explain how nurse educators can balance the principle of autonomy with the requirement to provide guidance to nursing students. Include examples of situations where these principles may conflict and how they can be resolved ethically. Answer: autonomy in nursing education emphasizes respecting students' rights to make their own decisions regarding their learning and professional growth. However, as educators, there is a responsibility to guide students and ensure they meet educational and professional standards. For instance, a student might insist on approaching patient care in a way they believe is correct but contradicts evidence-based practices. In this case, the nurse educator must balance the student's autonomy with the principle of beneficence, acting in the best interest of the patient. The resolution involves encouraging dialogue. Educators should foster open discussions explaining the rationale behind evidence-based practices, providing alternatives, offer choices within the framework of safe and effective care to respect the student's autonomy. Ethical framework. Reference the ANA Code of Ethics emphasizing Provision 7, which supports the educator's role in advancing the profession through scholarly inquiry and integrity in teaching. What are 3 strategies nurse educators can employ to minimize plagiarism in nursing education, and how do these strategies align with professional ethical standards? Answer: educating on plagiarism. Conduct workshops on what constitutes plagiarism and its impact on academic and professional credibility, aligning with the ethical principle of veracity. Using detection tools. Implement plagiarism detection software to ensure compliance with academic integrity while fostering transparency. Promoting original work. Encourage critical thinking and original writing by designing assignments that require personalized application of nursing concepts. These strategies align with professional ethics by fostering honesty and integrity, key components of both nursing education and practice. MS. Rodriguez, a nursing educator, discovers that a clinical student, Jane, documented false information in a patient's chart to cover up a medication administration error. What should MS. Rodriguez do, considering her legal responsibilities and ethical obligations? Answer: MS. Rodriguez must act promptly to address this situation while considering legal and ethical responsibilities. Immediate action. Notify the clinical supervisor and hospital administration about the inaccurate documentation as per institutional policies. Teach accountability. Meet with Jane to discuss the error, emphasizing the legal implications of falsifying records, including possible violations of state laws and licensure standards. Documentation and reporting. Document the incident and report it per institutional and regulatory guidelines, referencing the Nurse Practice Act, which mandates accurate and truthful patient record keeping. By addressing the issue transparently and using it as a teaching moment, MS. Rodriguez fulfills her role as an educator and ensures patient safety. Under FE, RPA, in what situations can nurse educators disclose student educational records without prior consent, and how should they ensure compliance with these exceptions? Answer: FE. RPA permits disclosure of student records without consent in specific situations, such as health or safety emergencies. Information can be shared if necessary to protect the health or safety of individuals. Legal requirements. Records can be disclosed in response to a subpoena or court order. School officials with legitimate interests. Educators can share records with staff involved in the student's education or support, provided they have a legitimate educational interest. To ensure compliance, limit disclosures to the minimum necessary information. Maintain documentation of the reasons and authorities requiring the disclosure. Provide students with prior notice when applicable. These safeguards align with legal requirements and uphold ethical principles of confidentiality. What steps should a nurse educator take to address implicit bias in their teaching practices, and how does this align with creating an inclusive learning environment? Answer: addressing implicit bias in teaching practices is crucial for creating an inclusive environment that promotes fairness and respect for all students. Nurse educators should begin by engaging in self-reflection to identify personal biases. This can be achieved through training programs and exercises that increase awareness of unconscious bias, helping educators become more mindful of how biases can influence their teaching. To further reduce bias, educators can diversify the curriculum by including case studies, examples, and role models from diverse cultural and socioeconomic backgrounds. This broadens students' perspectives and helps them appreciate the varied experiences of patients and colleagues. Additionally, educators should actively listen to students and create a classroom culture where every student feels valued and heard. These actions align with the principle of justice, which emphasizes fairness in treatment and opportunities. By fostering an environment that acknowledges diversity and promotes equity, nurse educators model the behaviors necessary for future healthcare professionals to provide culturally competent and inclusive care. Describe the key elements of designing a simulation scenario for advanced nursing students, ensuring alignment with educational goals and student learning needs. Answer: designing a simulation scenario for advanced nursing students requires careful consideration to ensure that it aligns with both educational goals and the specific learning needs of the students. The first key element is learning objectives. These objectives should be clear, measurable, and relevant to the specific competencies being targeted, such as managing complex clinical scenarios or practicing advanced critical thinking. Realistic context is another critical factor. The simulation must accurately reflect the clinical setting the students will encounter. This includes using high-fidelity simulators that replicate patient conditions as closely as possible, such as monitoring vital signs or demonstrating realistic physiological responses. This authenticity helps students immerse themselves in the scenario and practice skills they will use in real-world practice. Finally, assessment criteria should be integrated into the simulation. Clear guidelines on how students will be evaluated, whether for technical skills, decision-making, or communication, should be established upfront. This ensures that both students and educators have a common understanding of performance expectations. Dr. Carter notices that several students are hesitant during a high-fidelity simulation of a cardiac arrest scenario. The hesitation might lead to suboptimal patient outcomes in a real setting. What should Dr. Carter do to address this issue? Answer: Dr. Carter should take immediate steps to address the hesitation observed during the cardiac arrest simulation. First, pause the simulation and facilitate a debriefing session. This allows students to express their concerns and reflect on what caused their hesitation, whether it was a lack of confidence or uncertainty about the correct procedures. Creating a safe space for discussion will help students feel supported and encourage them to be more open about their challenges. After the debriefing, Dr. Carter should offer reinforcement through practice. This could involve additional skills training, such as repeated practice on CPR or defibrillation techniques, allowing students to gain confidence in performing these life-saving procedures under pressure. Providing positive feedback on small successes during the simulation will also help build their confidence. Additionally, Dr. Carter might consider breaking down the scenario into smaller, more manageable tasks, so students can focus on one skill at a time. This approach helps to gradually improve their performance and reduces the overwhelming nature of complex scenarios. What are 3 common pitfalls in designing simulation scenarios for nursing education, and how can they be avoided? Answer: 3 common pitfalls in designing simulation scenarios for nursing education are overly complex scenarios. Designing scenarios with too many variables can overwhelm students and prevent them from focusing on the key learning objectives. To avoid this, educators should prioritize one learning goal per simulation. Breaking complex scenarios into smaller, more manageable parts allows students to concentrate on mastering individual skills before progressing to more intricate situations. Lack of realism. If the scenario does not reflect real-world settings, students may struggle to transfer learned skills into clinical practice. Educators should use high-fidelity simulators, authentic clinical tools, and realistic patient scenarios. Involving patients, family members, or actors in role-playing exercises can also enhance the scenario's realism, making the simulation more engaging and relevant. Inadequate debriefing. Without a structured and reflective debriefing session, students may fail to recognize mistakes and areas for improvement. Educators should use evidence-based debriefing models, such as the Gibbs reflective cycle, to guide discussions and ensure that feedback is constructive and relevant. Explain the importance of debriefing after simulation and identify 3 best practices for conducting an effective debriefing session. Answer: debriefing after simulation is essential because it helps students reflect on their performance, recognize areas for improvement, and solidify their learning. Without proper debriefing, the educational value of a simulation can be lost, and students may miss the opportunity to improve their clinical judgment and skills. 3 best practices for conducting an effective debriefing session are: structured framework, use established models like PARLS, promoting excellence and reflective learning in simulation to guide the discussion. A structured approach helps ensure that all relevant aspects of the simulation are covered, including strengths, weaknesses, and lessons learned. Encouraging reflection. Ask open-ended questions to prompt students to reflect on their decisions, actions, and thought processes during the simulation. This allows students to become more self-aware and promotes active learning. Facilitator feedback. Provide specific, constructive feedback that is aligned with the learning objectives. Focus on what was done well and offer strategies for improvement. A balance of positive reinforcement and actionable feedback fosters a growth mindset in students. Why is interprofessional education through simulation vital in nursing education, and what challenges might arise when implementing IPE scenarios? Answer: interprofessional education through simulation is vital because it promotes collaboration and communication between nursing students and students from other healthcare disciplines such as medicine, pharmacy, and social work. This is crucial in fostering teamwork skills, which are essential for providing holistic and patient-centered care in real-world clinical settings. Through simulation, students can learn to respect the roles of other healthcare providers, develop problem-solving skills as a team, and understand how to work together to address complex patient needs. However, challenges may arise when implementing IPE scenarios, including logistical issues. Coordinating schedules for students from different disciplines can be difficult, particularly when multiple schools or departments are involved. This can be addressed by planning well in advance and using flexible scheduling options. Cultural differences. Each profession has its own culture, which can create communication barriers during simulations. Resource limitations. High-fidelity simulators and trained facilitators are often required for IPE simulations, but these resources may not always be available. Securing funding or sharing resources across institutions can help mitigate this issue. Explain the significance of implicit bias in nursing education and propose 3 actionable strategies educators can use to mitigate its effects. Answer: implicit bias refers to unconscious attitudes or stereotypes that affect understanding, actions, and decisions in an unconscious manner. In nursing education, implicit bias can manifest in the classroom, clinical evaluations, or interactions, leading to unequal treatment or opportunities for students. This undermines inclusivity and equity. Strategies to mitigate implicit bias. Implicit bias training. Regular training sessions using tools such as the implicit association test can help educators recognize and address their biases. For example, integrating real-life case studies into training can increase awareness and empathy. Standardized rubrics. Using structured and objective rubrics for evaluating student performance minimizes the impact of subjective biases. Diverse representation. Incorporating diverse role models in curriculum content in classroom settings fosters a sense of belonging among underrepresented groups. Dr. Patel is integrating a virtual learning environment, BLE, for a critical care nursing course. One of her students, Mary, complains that the asynchronous format hinders her ability to grasp concepts due to limited peer interactions. What strategies can Dr. Patel employ to balance asynchronous and synchronous learning effectively? Answer: Dr. Patel can adopt a blended learning model to address Mary's concerns while retaining the flexibility of the VLE. Weekly synchronous discussions. Schedule live Q&A sessions or discussions where students can interact with peers and instructors in real time. Peer learning opportunities. Create collaborative tasks within the VLE, such as group projects or discussion forums to enhance interaction. Scaffolded assignments. Introduce step-by-step guides in assignments that encourage sequential understanding. Guideline reference. The Quality Matters rubric emphasizes designing courses that combine engagement, interaction, and accessible learning opportunities to optimize student learning outcomes. Discuss 3 social determinants of learning in nursing education and suggest interventions to address them. Answer: social determinants. Socioeconomic status. Financial challenges can limit access to resources like textbooks or internet connectivity. Intervention. Provide institutional resources such as scholarships or loan devices to students in need. Cultural backgrounds. Students from diverse cultural contexts may face barriers in understanding dominant teaching norms. Intervention. Incorporate culturally relevant examples and multilingual resources in teaching. Mental health. Stress and anxiety, especially during clinical training, can affect learning. Intervention. Offer counseling services and resilience-building workshops. Guideline reference. The World Health Organization, WHO, emphasizes equitable access to education as a determinant of effective learning outcomes. Compare the advantages and limitations of using mobile learning applications in nursing education. Answer: advantages. Accessibility. Allows students to learn anytime and anywhere, fostering flexibility. Interactive content. Incorporates quizzes, simulations, and videos to enhance engagement. Customization. Tailors learning paths based on individual progress. Limitations. Digital divide. Not all students have access to smartphones or reliable internet. Cognitive overload. Excessive app usage can lead to fragmented learning. Security concerns. Risks of data breaches in apps storing sensitive information. Guideline reference. The NMC Nursing and Midwifery Council encourages using innovative technologies while ensuring accessibility and security. How can educational analytics and big data improve curriculum design in nursing education? Provide an example. Answer. Educational analytics leverages data to identify learning patterns and improve decision-making. Personalized learning. Analytics can track individual student progress, enabling educators to customize teaching strategies. Predictive modeling. Predicts student performance trends, allowing for proactive interventions. Curriculum refinement. Aggregates feedback to identify areas requiring curricular improvements. Example. A nursing school uses big data to analyze NCLE exam results. The data reveals that students consistently underperform in pharmacology, prompting targeted workshops and curriculum adjustments. Guideline reference. The Institute of Education Sciences advocates data-driven decisions to optimize student success. Lisa, a single mother returning to nursing school, struggles to balance coursework, clinical hours, and childcare. As her instructor, how can you support her success without compromising academic standards? Answer. Supporting non-traditional students like Lisa requires flexibility and a commitment to inclusivity. Flexible scheduling. Offer options for clinical hours outside of standard times such as evening or weekend shifts to accommodate her childcare needs. This flexibility helps her fulfill program requirements while managing personal responsibilities. Access to resources. Provide information on campus resources such as daycare services or parenting support groups. Partnering with local community services to offer childcare grants or discounts can also reduce stress. Peer mentorship. Connect Lisa with a peer mentor who has experience balancing education with family life. Peer support is valuable for sharing strategies and providing emotional encouragement. Academic support. Ensure Lisa has access to tutoring or academic counseling to help manage her workload. Online resources or recorded lectures can also provide flexibility in reviewing content at her convenience. What are the key cybersecurity measures that nursing educators must implement in online learning environments to protect student data? Answer. Cybersecurity in online learning is critical for safeguarding sensitive student and educational data. Key measures include data encryption. Encrypt all student data, including grades and personal information, during transmission and storage. This ensures that even if data is intercepted, it cannot be accessed or misused. Access control. Implement multi-factor authentication (MFA) to secure access to online learning platforms, requiring users to verify their identity through multiple steps. This minimizes unauthorized access. Regular security audits. Perform frequent security audits of online platforms to identify vulnerabilities and ensure compliance with data protection standards. Awareness training. Educate students and faculty on best practices for cybersecurity, such as recognizing phishing attempts, avoiding weak passwords, and ensuring safe device usage. Compliance with regulations. Ensure the online platform complies with relevant laws such as HIPAA for healthcare-related data and FE, RPA for student privacy. Define inclusive pedagogy and outline its application in clinical simulations for nursing students. Answer. Inclusive pedagogy involves creating learning environments that accommodate diverse student needs, backgrounds, and learning styles. It is designed to ensure all students feel valued and supported. In clinical simulations, inclusive pedagogy can be applied in several ways. Diverse scenarios include case studies that represent a variety of cultural, socioeconomic, and gender perspectives. For example, a clinical simulation about managing diabetes can present patients from different ethnic backgrounds, each with unique health needs. Scaffolded learning. Provide support and structure for students who need additional help, allowing them to gradually take on more complex tasks. For instance, students can begin with simple tasks like patient assessment before moving on to complex decision-making. Multiple modalities. Offer different formats of content delivery, such as video reading materials and hands-on practice to meet diverse learning preferences. Student feedback. Collect feedback from students on how the simulation reflects their cultural and learning needs and adjust future simulations accordingly. How can nursing educators integrate global health issues into their curriculum? Answer. Integrating global health issues into nursing education helps prepare students for the increasingly globalized nature of healthcare. Educators can incorporate these issues through case studies on global health issues. Use real-world case studies to discuss global health challenges such as infectious diseases, e.g., malaria, tuberculosis, or non-communicable diseases, e.g., diabetes, cardiovascular diseases that disproportionately affect certain populations. Collaborative. projects with international programs, encourage partnerships with nursing schools from different countries. This fosters cross-cultural learning and exposes students to varying healthcare practices. Field exposure and study abroad programs. Organized study abroad programs or virtual exchanges with institutions in different parts of the world. This allows students to witness healthcare practices in diverse settings and understand the challenges of global health. Guest speakers and expert panels invite healthcare professionals from international organizations such as the WHO to speak about pressing global health issues, including disparities in care and global pandemics. What are the ethical considerations of using artificial intelligence (AI) in nursing education? Answer: the use of AI in nursing education presents ethical challenges that must be carefully addressed to protect both students and the integrity of the educational process. Bias in algorithms. AI systems may inherit biases from the data they are trained on, potentially perpetuating racial, gender, or socioeconomic inequalities. Nursing educators must ensure that AI tools are regularly audited for fairness and inclusivity to avoid reinforcing biases in assessment or learning content. Privacy concerns. AI systems often require access to large amounts of personal data, raising concerns about data privacy. It's essential to ensure AI platforms comply with regulations such as HIPAA for protecting students' personal and healthcare information. Transparency in AI usage. Educators must ensure that students understand how AI is being used in their education, particularly if AI is involved in grading or personalized learning paths. Clear communication is crucial to maintain trust. Accountability. AI should not replace human judgment in clinical assessments or student evaluations. Educators should maintain oversight and ensure AI is used as a supportive tool, not as a sole decision maker. Explain why interprofessional education (IP) is critical for improving healthcare delivery. Provide examples to support your answer. Answer: IP is critical because it fosters collaboration among healthcare professionals, which enhances patient care and safety. For instance, improved communication. Effective IP teaches healthcare professionals to communicate clearly, reducing errors. For example, a nurse trained in IP might clarify ambiguous physician orders, preventing medication errors. Team-based problem solving. IP cultivates teamwork skills essential for handling complex patient cases. For instance, during a cardiac arrest scenario, nurses, doctors, and respiratory therapists trained together can act swiftly and cohesively, understanding roles. It helps professionals understand each other's roles, leading to better utilization of expertise. For example, recognizing a pharmacist's role in medication management can prevent polypharmacy risks in elderly patients. IP is supported by frameworks such as the World Health Organization's Framework for Action on Interprofessional Education and Collaborative Practice, which emphasizes that IP leads to health system improvements globally. What are the stages of professional identity development for nurse educators, and how do these stages influence teaching practices? Answer: professional identity in nurse educators evolves in stages. Novice stage: the educator focuses on mastering basic teaching skills, often relying heavily on clinical expertise rather than pedagogical principles. Transition stage: the educator starts integrating teaching strategies with clinical examples, balancing roles as a clinician and instructor. Integration stage: the educator develops a strong sense of professional identity, engaging in research, mentorship, and advocacy for the nursing profession. The social identity theory supports this process, asserting that individuals adopt behaviors aligning with their professional roles, influencing their teaching practices and relationships with students. Identify 3 common barriers to IP implementation and propose solutions for overcoming each barrier. Answer: 3 common barriers are: barrier, resistance from faculty due to lack of training. Solution: provide faculty development workshops focused on IPE, principles and collaborative teaching methods. Barrier, scheduling conflicts between different professional programs. Solution: develop shared scheduling software and establish common IPE. Time blocks in the curriculum. Barrier, insufficient administrative support. Solution: advocate for IPE by presenting data on improved patient outcomes linked to collaborative practice aligning with organizational goals. The Canadian Interprofessional Health Collaborative (CIC) Competency Framework offers guidelines to address such barriers systematically. Critically evaluate 2 methods for assessing IPE outcomes, focusing on their strengths and limitations. Answer: self-assessment surveys. Strengths: these surveys are cost-effective and easy to implement, providing immediate feedback from participants regarding their perceived learning and teamwork abilities. They can be administered quickly and to large groups, making them scalable. Limitations. Self-assessments can be biased, as participants may rate their skills higher than they actually are. This can lead to inaccurate data, making it difficult to assess true competencies. Additionally, these surveys may not capture the depth of learning or provide specific areas for improvement. Simulation-based assessments. Strengths. Simulations offer a controlled environment where interprofessional teams can demonstrate their collaborative skills in realistic scenarios. They provide valuable insights into teamwork, decision-making, and communication, and allow for real-time observation of behavior. Limitations. The cost and resources required to set up high-quality simulations can be prohibitive. Furthermore, simulations may not always reflect the complexity of real-world situations, leading to a potential gap between performance in simulation and actual practice. Dr. Emily Morgan, a newly hired nurse educator, struggles to balance her teaching responsibilities with her ongoing doctoral research. She is also unsure how to integrate innovative teaching strategies into her courses. What steps should Dr. Morgan take to address these challenges? Answer: Dr. Morgan should consider the following steps. Engage in faculty development programs. These programs can offer time management strategies and guidance on balancing clinical, academic, and research responsibilities. Many institutions provide resources specifically tailored for new faculty members. Seek mentorship. Pairing with an experienced faculty member can provide Dr. Morgan with practical advice on handling the dual roles of educator and researcher. A mentor can also help navigate institutional expectations and provide insight into integrating research into teaching. Leverage institutional resources. Many universities offer instructional design support to assist with course planning and technology integration. By collaborating with instructional designers, Dr. Morgan can more easily incorporate innovative teaching methods like flipped classrooms or interactive technologies. Prioritize and delegate. Dr. Morgan should identify her most pressing academic and research tasks and delegate non-essential activities where possible, such as administrative duties or grading, to teaching assistants. How do collaborative practice competencies impact patient-centered care? Illustrate with examples. Answer: collaborative practice competencies such as effective communication, role clarity, and shared decision-making are essential for delivering patient-centered care. These competencies ensure that healthcare teams work cohesively, resulting in improved patient outcomes. Example 1. Effective communication. Effective communication allows healthcare professionals to share vital information about a patient's care. For instance, a nurse who effectively communicates with the physician about a patient's allergic reaction to a medication can prevent further complications. Example 2. Role clarity. Understanding each professional's role in the team enhances efficiency. A pharmacist, for instance, may identify medication discrepancies that physicians and nurses may miss. This leads to safer medication practices and better patient safety. Example 3. Shared decision-making. In complex cases such as managing chronic conditions like diabetes, shared decision-making allows patients to be involved in their care plan. Nurses, doctors, and dietitians working together can create a personalized treatment plan, ensuring that patients are well informed and empowered to make choices about their health. Why is lifelong learning essential for nurse educators, and how can it be integrated into their professional development? Answer: lifelong learning is crucial for nurse educators to stay current with advancements in healthcare, teaching strategies, and educational technologies. Continuous education ensures that educators are equipped with the most up-to-date knowledge, which directly impacts their teaching effectiveness and student outcomes. Attending conferences. Conferences provide opportunities to learn about new research, best practices, and innovations in nursing education. Engaging with experts in the field helps educators refine their teaching practices. Engaging in research. Nurse educators can enhance their professional development by engaging in research projects, allowing them to contribute to evidence-based practices in nursing education and gain a deeper understanding of current trends in pedagogy. Pursuing certifications. Educators should pursue certifications in specialized areas such as simulation or online learning to increase their teaching proficiency. Certification programs often provide structured learning that builds on existing knowledge and skills. Peer collaboration. Collaborating with colleagues to share knowledge and teaching strategies is also an important form of ongoing learning. What strategies can nurse educators use to balance clinical responsibilities with academic teaching? Answer: nurse educators often juggle clinical responsibilities with academic teaching, which can be challenging. The following strategies can help achieve a balance. Time management. Nurse educators should use time blocking techniques to allocate specific hours for teaching, clinical duties, and research. This ensures that each responsibility receives adequate attention without overwhelming the educator. Integration of roles. One effective way to balance both roles is by integrating clinical experiences into the classroom. For example, educators can use real patient cases to teach theoretical concepts, saving preparation time while enriching the learning experience. Delegation. Delegating administrative tasks, such as grading or managing course logistics, can free up more time for clinical duties. Teaching assistants or technology tools can assist in this process. Collaboration with colleagues. Collaborating with other faculty members allows for shared responsibilities, such as co-teaching or joint clinical supervision, reducing individual workload. Outline the key components of an effective IPE, curriculum, and the rationale behind each component. Answer: an effective IPE curriculum should include the following components. Clear learning objectives. These should outline the specific skills and competencies students should achieve, such as enhanced teamwork, communication, and clinical decision-making. Setting clear objectives ensures that the curriculum is focused and measurable. Interactive learning activities. Methods like simulations, role-playing, and case studies engage students and provide hands-on experiences in working collaboratively. These activities promote practical skills that are crucial for real-world healthcare practice. Assessment tools. Incorporating both formative and summative assessments, such as peer evaluations and self-reflection journals, allows for ongoing feedback and final evaluation of students' collaborative competencies. Faculty development. Faculty must be trained in interprofessional teaching methods to model effective collaboration. Ongoing development helps educators integrate IPE principles into their teaching strategies. Reflective practice. Encouraging students to reflect on their experiences promotes deeper learning and understanding of their role within the healthcare team. How does participation in professional organizations benefit nurse educators? Answer: participation in professional organizations provides significant benefits for nurse educators, both personally and professionally. Networking opportunities. Joining organizations like the National League for Nursing, NLN, or the American Association of Colleges of Nursing, OCN, allows educators to connect with peers, mentors, and experts. This collaboration can lead to career advancement, research opportunities, and support for teaching innovations, access to resources. Professional organizations often provide access to the latest research, educational materials, and funding opportunities. This helps educators stay current with trends and advancements in nursing education, advocacy, and policy influence. Nurse educators who participate in these organizations can advocate for policies that support nursing education and practice. For instance, they can influence changes in curriculum standards or promote funding for educational research, career development. Organizations offer certifications, continuing education programs, and leadership development opportunities, which are essential for career progression.